Kate, very good morning. First question, was the WHO's decision to declare a public health emergency of international concern warranted?
Yes, I believe it was. We at the Red Cross are happy to hear that it has been declared a public health emergency of international concern. It doesn't change anything on the ground for us. We're still responding. We will still have volunteers. We have over 1,400 volunteers on the ground. One of the concerns is because it has reached Goma. There was a confirmed case imported to Goma. So it's really about making sure that enough funds and resources can be available for the response, and also increasing preparedness of the regional countries as well.
Now, that one case you mentioned that's reached Goma, it was a 46-year-old priest who traveled to that city by bus. What are the local authorities doing to curb that type of movement from the affected areas to areas maybe that are not that don't have the virus?
So, yes, that's correct. He had arrived on a bus from Vitembo. There are a number of point of control or point of entry screening, and the preparedness in Goma did activate correctly. He was actually identified very quickly. He was sent to get treatment and isolated as quickly as possible. So I think it's fair to say that actually the system was in place and it is working, and it's really just about being extra vigilant and really making sure that anyone who is showing symptoms is referred to an Ebola treatment center as soon as possible.
Now, more than 1,600 people have died so far from the outbreak from 2018. This is not the first time we've had an outbreak in the DRC. What did we learn from before, and how is that helping, maybe curb the spread at the moment?
Yes, so this is the 10th outbreak in Democratic Republic of Congo. The 9th outbreak happened actually just before the 10th outbreak in Bandaka. It was actually under control within 3 months. What's really changing the 10th outbreak is the region, North Kivu and Ituri. It's a region of high population movement. There's been conflict in the area for over 20 years, and it's also high population density. So there has been a lot of lessons from the previous 9 outbreaks, but what we're finding in this 10th outbreak is that it's much more complicated as well.
Kate, lastly, is there a real danger that the surrounding countries around the DRC could also be affected if this is not controlled properly?
That is correct. There is a high regional risk that Ebola may spread across borders. The Red Cross is already active in Rwanda, Uganda, South Sudan, Burundi, and working with the national authorities to be prepared in case this happens. And we have already had one case on the 14th of June from a family that was in Democratic Republic of Congo that went into Uganda. So the systems are in place. Preparedness efforts are also ongoing. So it is a risk, but we're also confident that we are prepared.
Okay, just are you getting enough support, financial and otherwise?
I think the financial support is really important. We're going into nearly 12 months. It requires a lot of resources. And so my appeal would be to regional governments and also globally that we do need more financial resources to be able to implement the activities to stop Ebola.
All right, thank you so much. That's Kate Lenmoth from the International Committee of the Red Cross talking to us about the situation in the DRC. More than 1,600 people have died so far from the current Ebola outbreak in that country.